Danny Panzella reporting from the Upper West Side of Manhattan, which is a hotspot for flu activity this season, according to the New York Post. It's everywhere you look. People coughing, sneezing, and dreary from this year's seasonal flu. The news cycle is dominated by stories about the flu pandemic, while corporate sponsors push the flu vaccine as our savior. But just how much of the flu hysteria is hype, and how effective are flu vaccines? Reuters reports that the United States is officially in an epidemic. But how does the CDC define an epidemic? An epidemic occurs when the number of people infected climbs well above what is normally expected for that place and time. The CDC reports that the baseline for doctor office visits for influenza-like illness in the United States is 2.2%. The week ending December 29th, the rate was 5.6%, over twice the baseline amount of visits. But even the CDC admits that last year's flu season was mild, and this year's flu season has come early, and it is too early to tell how long it might last. The flu season may, in fact, end early, resulting in an average number of yearly cases. You may have heard the media toss around the term pandemic, which sounds even scarier. But what does it mean? According to Wikipedia, a pandemic is an epidemic of infectious disease that has spread through human populations across a large region. For instance, multiple continents, or even worldwide. Disease that is stable in terms of how many people are getting sick is not a pandemic. The seasonal flu does not qualify generally as a pandemic. Should you get a flu shot? The Center for Infectious Disease Research and Policy at the University of Minnesota released a report last month saying that influenza vaccines provide only modest protection for healthy teens and adults and little, if any, protection for the elderly. According to the study, the report's authors concluded federal vaccination recommendations are based on inadequate evidence and poorly executed studies. We have over-promoted and overhyped this vaccine. It does not protect as promoted. It's all a sales job. It's all public relations, said Michael T. Osterholm, the current director of the Center for Infectious Disease Research and Policy. Osterholm is also the director of the Center of Excellence for Influenza Research and Surveillance and has served at the CDC as well as a bioterrorism and public health preparedness advisor to the Health and Human Services Department. I'm an insider, Osterholm said. Until we started this project, I was one of the people out there heavily promoting the influenza vaccine use. It was only with this study that I looked and said, what are we doing? Osterholm says he still considers himself a pro-vaccine guy. Use it, but just know it's not going to work nearly as well as everyone says. Every year, flu shots are reformulated in an attempt to match the strains experts think might circulate that season. The effectiveness of the vaccine depends on how accurate the scientists guess. You may have heard media reports of deaths from the flu. The CDC refuses to publish accurate numbers on deaths from the flu, partially because those deaths are so hard to track. Instead, they estimate that anywhere from as few as 3,000 to as many as 52,000 Americans die of the flu each year. 90% of them are elderly. The Cochrane Collaboration, an international network of experts that evaluates medical research, concluded in 2010 that vaccines do not affect the number of people hospitalized and have minimal impact in seasons when vaccines and viruses are mismatched. Another Cochrane review found no evidence that vaccinating healthcare workers who work with the elderly has any effect on flu or pneumonia deaths. Not having evidence doesn't prove it doesn't work. We just don't know, said Dr. Roger Thomas, a Cochrane Collaboration coordinator for the University of Calgary in Alberta, who was an author on both reviews. The intelligent decision would be to have a large, publicly funded, independent trial. Recently, major pharmaceutical companies' reputations have been called into question. GlaxoSmithKline recently pled guilty to bribing doctors, fabricating drug safety data, and lying to the FDA. Merck was caught falsifying data to show a 95% vaccine efficacy rate. The CDC openly admits that vaccines contain a toxic cocktail of metals and synthetic chemicals that we know cause neurological damage. Those include aluminum, mercury, and formaldehyde. Most experts agree the flu shot is only about 62% effective. So if the flu shot is ineffective or potentially dangerous, what can you do to stay healthy? The only sector of the United States that has not seen a premature spike in flu cases this year was the Southwest, according to the CDC. Many nutritionists and doctors argue that cold weather experienced by most of the country during the winter keeps people inside, denying them exposure to sunlight that promotes vitamin D production necessary for a healthy immune system. If you can't get outdoors for at least 30 minutes of beneficial sunlight, doctors recommend taking at least 5,000 IUs of vitamin D each day during the winter flu season. In addition, trace minerals like zinc can also help protect you. In the end, it's up to you to decide which way is right for you to maintain your own health. The most important factor is that you do your own due diligence and research the potential preventative measures as well as treatments for the seasonal flu. I'm Danny Panzella, reporting for TruthSquad.tv.
Them out, or let me defend myself. You don't have to defend yourself. The burden of proof is on them. Keep your damn mouth shut.
This policy is not a problem. It's a solution for organizing urban space.